Okay.
Yeah. So our next speaker is Krasimira Tsaneva-Atanasova from Exeter. And she will present us about the EPSRC Hub for Quantitative Modeling in Healthcare. The floor is yours.
Thank you very much, Crow, and thank you very much for inviting me to talk to you today. It's I'm really enjoying it so far. The presentation has so far have been very, very interesting, and as everybody is acknowledging, I can see potential for collaborations and some common themes that are emerging. So our hub, similarly to the hub in Cambridge, is a second generation, if I can use the terminology that Crow used earlier today, of this investment on the interface between mathematics and healthcare. And it was launched very recently in February. So we have been operating only a few months, but hopefully I have some interesting things to show you already. Who we are, we have a number of investigators listed here. 6 of us are investigators from mathematical and statistical background, and we have 3 co-investigators from biomedical and clinical backgrounds. Our hub is also a collaboration between Exeter and Imperial College. One of our co-investigators is from Imperial College London. We are based in the Living Systems Institute in Exeter, basically shoulder, very close to other biomedical scientists and research laboratories in the same building. Our hub is literally, physically and virtually collocated between all the STEM colleges. Exeter is a small university, and that facilitates, I guess, interaction between various departments and colleges across the university. It brings together over 30 academics and researchers with expertise across applied mathematics, statistics, particularly featuring uncertainty quantification, dynamic network modeling, mechanistic modeling, and dynamical systems analysis. We have extensive academic collaborations, both nationally and internationally, and established links with patient groups and stakeholders. And we are constantly growing our base of industry collaboration and relations with health tech sector and NHS. So what is the focus of the hub? We have 2 main research teams on the methodology and modeling side. Team 1 is focusing on uncertainty quantification, generally theoretical and methodological development. This is a team that we had in our previous center as well. We have applied to problems in neuroscience previously, and now we're continuing with other application areas. And we have a second team, which is new for this hub. Now it's on reversibility and resilience, and is focusing on mathematical approach to evolving microbial communities with implications and applications to antimicrobial resistance. You can see on that diagram here the way we see these the hub operating. So these methodological and theoretical teams are focused on 3 application areas. The first one revolves around diabetes and endocrinology. Yeah, I should point out that these application areas are drawn from the strengths at the University of Exeter. We have recently established a Center for Excellence in Diabetes Research, funded by Research England. And we have very strong teams in diabetes and endocrinology working on the interface between biomedical and clinical research. We also have the newly established Center for Medical Mycology at the University of Exeter. It launched a few in the autumn, and it focuses on infectious medicine and antimicrobial resistance. And we're continuing with applications to neurology and mental health. At Exeter, we had a Wellcome Trust funded Center for Mood Disorders, looking at various types of mental health conditions such as depression, PTSD, anxiety, and other similar conditions. So basically, in these three application areas, with these three application areas, we are addressing all the four current challenges as were described in the talk by EPSRC earlier, and in collaboration with our industry partners, data science partnerships, and clinical partnerships. And now I will briefly give you some examples of the research that is going on. So the team one, focusing on uncertainty quantifications, more specifically decision-making and uncertainty quantification, is led by Peter Challenger, who is a co-investigator on the hub and also was investigator in our previous center. And we have hired a postdoc, Evan Baker, already working on this team. These bullet points basically summarize the ideas behind this topic. Numerical models are increasingly being used in healthcare, as we actually saw in the previous two talks by the Cambridge and UCL hub, and they are ideally targeted at enabling clinical decision-making, even in real time. So if we are to use such models, they need to be calibrated. Again, we saw this in the previous talks, and importantly, to include measures of uncertainty. Due to the complexity of these models, we can't afford to use sampling methods with the actual original models, the raw data. So emulators are basically desirable and helpful in some situations. So the idea is to use surrogate models with known uncertainty that are known as emulators and enable reliable prediction, sensitivity analysis, uncertainty analysis, and model calibration. And here is just an example of a project that Evan is already working on in collaboration with our co-investigator from Imperial College, Wojciech Dilo, on trying to develop emulators for physiological data based on hormone levels measured in the blood of patients. And you can see, as with all physiological data, it's uncertain, it is also very irregular, and it's very dynamic as well. These are all challenges for the current state of emulator scale capabilities. So that's one of the challenges we are addressing. On the topic of microbial communities and interactions with applications to antimicrobial resistance, we are looking at rich data sets based on sequencing of various microbiomes and applications to phage therapy. The team at Exeter that is working on this topic is composed by Ivana and Rob, who have worked on this for a long time, and our postdoc Emily, who started in April, is working closely with them on various applications to, I mentioned, real-time sequencing of long-term infections and analyzing this data and looking for global resistant patterns in collaborations with clinicians from Bristol, nationally as well as internationally. We have, they have collaboration with a clinician in Sydney and UCSD as well as Madrid. And the final example is a collaboration, again, a partner on our hub, a collaboration with a clinician from NTU in Singapore. This is just a quote that he used to describe our collaboration and how he felt when we started working together a few years ago, a couple of years ago. We have a joint PhD student funded by NTU Exeter PhD program, and he has been working on integrating complex microbiome sets using network approaches and data fusion. And this has been applied to combining bacteria, fungal, and virome data from patients with chronic lung condition, in this case, bronchiectasis. The research was published last month in Nature Medicine, where we showed that by combining the information from these three different microbial data sets, we're able to come up with better prediction in terms of the condition of a patient and inform clinical decision making, also in terms of antibiotic treatments or combinations of drugs. The idea is that it's not a single pathogen that is responsible for worsening or improving of the condition of the patient, but it's rather the combination and the interaction between these microbial species that drives patient's state. And yeah, we were able to show this with data from various sources, cross-sectional as well as longitudinal. So that's my last slide, just highlighting some of our initial partners. We have computer software developers from IBM, the Alan Turing Institute, as all other hubs. We have a range of hospital trusts on board, as well as healthcare companies and some international partners. And as previous speakers mentioned, we are looking for collaboration and expanding our networks. So I'd like to thank you once again for inviting me, and I'm really looking forward for more joint initiatives and events in the future. Thank you.
Thank you so much, Krasimira. That was a super, super interesting talk. Thank you. I can tell that you're also quite excited about what lies ahead. Yeah, no, great, thank you. Are there questions for Krasimira?
If I can just add something on the previous conversation about the systems. In the hospital, the main hospital in Exeter, RD&E also has the EPIC system, similar to Cambridge and UCL, which is not very common in the UK. So that is definitely something which would be really interesting.
That is a sign for us. There's a sign for us that we should talk more.
Yes.
Yeah, it's there is a drive, I think, from the UKRI for hospitals with the same electronic healthcare record to work more closely together. So there's also a research group being formed across the hospitals, which I think we're now up to 6 in the UK with EPIC, either installed or due to be installed in the next 12 months. So it'll be a good platform to collaborate across for sure.
Yeah, absolutely.